If you have any elbow pain, I got your back, because in this video, you're gonna learn the key movements that need to be improved when someone has elbow pain, and you're gonna get 3 exercises that fix about 90% of elbow issues. Now, before I show you what those are, we have to go over the 10% that this won't benefit, so that way you don't waste your time. If you've had any elbow trauma that is acute, meaning like you fell on your elbow, or you popped your inner elbow while you were throwing a baseball, anything like that, these aren't the moves. If you're noticing any numbness, tingling in your arm, that would be another time we wouldn't want that. If structurally you're limited in elbow extension to a significant amount, I would strongly encourage you to get that checked out. Otherwise, these moves are going to be fair game. But to know what you need to do, we have to talk briefly about elbow biomechanics. There's 4 movements that occur at the elbow: bending, showing off the meaty biceps, straightening, and then there's pronation, which is where the hand goes downward, and supination, where the hand moves upward. Here's the interesting thing about these movements. They all have rotation built within them. When you bend your elbow, the forearm progressively supinates, meaning that the palm will rotate up towards the shoulder. And then when I straighten the elbow, the forearm actually pronates, or it twists inward. And so a lot of our mobility drills need to actually focus on improving this ability to twist and rotate. The 3 movements that people are most limited in, unless there was trauma, are that pronation and supination, as well as elbow flexion. The first thing you want to do is maximize the amount of space in the elbow joint. That happens when we restore external rotation-based measures. The external rotation measures of the elbow will be supination at 90 degrees. Here's how you go after that. Lie on your side, bottom arm less than 90 degrees, bottom knee less than 90 degrees. There's 2 contact points that you need to feel: the outside elbow and the outside knee on the down leg. You're gonna take your top arm and leg, roll everything forward like this. You're not reaching like that, but you're gonna roll forward so that way you get those points touching the ground. If you don't have that, put a wedge under your arm and your hip, and they'll take care of that. Silently breathe in through your nose. On the exhale, you're gonna slowly put your weight on those 2 points and push yourself up. It's subtle, it's slow, it's chill. Hold this position and breathe. Try 5 sets of 5 breaths, 2 times per day for 2 to 4 weeks for that move. That move gets external rotation at the forearm, but it doesn't do so at the humerus. For that, you actually need to drive pronation at 90 degrees of elbow flexion. Here's how we can do that. Arm at a 90-degree angle. The bottom knee is gonna be less than that. You're gonna take the top arm and leg, roll everything forward so you can contact 2 points, the outside knee and the wiggly bone on the wrist called the pisiform. To get that, you'll wanna make a C grip with your hand, and then you're gonna rotate that C down to capture the position. Eyes looking ahead, silently breathe through the nose. On the exhale, you're gonna push yourself up through those 2 points at about a 3 out of 10 effort. Hold this position and breathe, maintaining that pressure. If you're struggling getting those points, just like with the other exercise, you can use wedges to tip you into position. Try 5 sets of 5 breaths, 2 times per day for 2 to 4 weeks with that move. And last but not least, and certainly a beast, is elbow flexion. Because I'm going through more range of motion, it's going to require more rotation at the humerus, specifically external rotation. In order to maximize external rotation, I need to be able to expand the upper back, or the posterior upper part of the thorax. If I can do this, this alters the scapular positioning, so that way external rotation can be produced at the arm. Here's how you can do that. Be about your foot length away from the wall. You're gonna rest against it. You should have weight on 3 points. The backbone's just above the pelvis, called the PSIS, the inner heel, the base of the big toe. Look straight ahead, slide down till you really feel heavy on those 3 points. You'll feel your quads work. Arms are gonna be up like so. You're gonna silently breathe in through your nose, exhale through the mouth, maintaining that position. You'll feel your upper back moving if you get it right. Just make sure you're not forcing the position and crunching or reaching, because that's gonna round the back, which is gonna limit your mobility gains, influencing your elbow. Try 5 sets, 5 breaths, 2 times per day for 2 to 4 weeks with that move. Now with elbow pain, it's common to have shoulder mobility restrictions that can impede your progress. If you're still having some issues, I'd try some of the exercises in this video right here. It'll help improve your shoulder mobility.